I'm Marissa with Beard Family Chiropractic. I'm going to show you some rebozo sifting with Katie here. So for this, traditionally it's used by Mexican women they use a true rebozo, which is a really neat piece of fabric that they use through their pregnancy and then also into the birth and care of their child. So it's a really sacred act. This is not true rebozo sifting. This is just sifting because I just have a woven wrap, or you can use a bed sheet, whatever you have that's big. Okay, so I'm going to find the center of my woven wrap, and I'm going to place it in the center of Katie's belly. Alternatively, you can place it yourself and then give it to your partner or whoever's assisting you in your sift if you're at home. Okay, I'm gonna pull it, so I want it to be nice and flat on her. So she goes ahead and comes up so we can see her belly. We don't want it to be super wrinkled or tight on any one spot. So you can see it's pretty well covering everything. If I pull it, she doesn't feel any pressure at any specific part of her belly. It's nice and broad. Go ahead and rest again. And she's just resting her chest on a ball. You don't have to have a ball. You can be like in a plank position or even on your hands and knees. But this is comfortable if you have a ball at home, which you should, because you shouldn't be sitting on a recliner anymore when you're pregnant. It's not good for your baby positioning. So the trick here is really pulling out the tension first. So I have this in a comfortable position. I don't want to be way up here. I want to be able to kind of use my legs and my body to pull the tension out of her belly. So you'll see the low back go from being arched to really being flat. Pulling tension out just a little bit, and then it's a little sift. Again, it's like we're sifting flour, sifting sugar, making pastry. We're not shaking it so hard that I shouldn't see her back really moving or her moving side to side. It should feel pretty good on her belly, and it should feel even. Does it feel even?
Yes.
Yeah.
Baby's moving a lot with this too.
Yes, so we're creating space. This is really nice if you have round ligament pain, if you have pubic symphysis dysfunction, anything going on the front. It can really help with back pain as well, because it's going to help baby get positioned better over the hips and pelvis. So I'll do this you can do this for as long as your biceps will hold on. The joke is in labor, you better have good biceps, because this feels really good when we are in labor, but it's also something that needs to be done. Again, I recommend at least a few times a week, but if you can daily after that 27, 28 week mark, this is really going to help your function and also your baby position be really good. Okay, and as we come out of it, this is important too. So we want to gently release the tension. You don't want to just drop her. She won't like that.